Hello everybody, this is Farahati. I'm using Health Economics book, 6th edition by Santerre and Neun. This is chapter 5, the demand for medical care, lecture 1, the law of demand. The demand for medical care and the law of demand. In the previous lectures, you learned that health is a dynamic process. Each of us was born with the initial stock of health, and then over the years, our health depreciate because of the aging and so many other factors that we talked about. And then we can invest on health, on medical care. So health is a durable good. We can actually invest on health by consuming medical care to generate utility. Basically, we improve our health and we get happier, we become happier, and then we generate, basically, this is generating utility. Utility is an index measurement to measure our happiness in economics. So by spending actually more on medical care, we improve our health and improve our utility, increase our utility. Utility, therefore, is a function of quantity of medical care. Ceteris paribus, assuming all else being constant, by increasing the medical care, utility, or we are increasing the utility. But remember that we are dealing with the law of diminishing marginal utility, means that although by increasing the quantity of medical care, we are improving the health, our health, and happiness and utility, but this is actually increasing in the diminishing rate. And from the other side, if we talk about our health in terms of production of health, when we are using medical services as an input to produce health, again, we are improving and producing more health, but because of the law of diminishing marginal productivity at a decreasing rate, basically, as we are in using more medical services as an input, we are increasing production of health, but at the diminishing rate. And remember the example we had before. If you actually are taken to the hospital by ambulance, the first day in the hospital, using the medical services has a bigger utility than the second and the third day in the hospital. So each excessive amount of consuming medical services produce less and less marginal productivity of health over the time. So if we wanted to show that graphically, in the horizontal axis, we have the quantity of medical care, Q. In the horizontal axis, and in the vertical axis, we have the utility, amount of utility in the vertical axis. And we wanted to show the relationship between utility and medical care, which means that as we are increasing the quantity of medical care, we are increasing the utility, but each successive amount of medical care increasing the utility at the decreasing rate because of the diminishing marginal utility. So that has a very, very big application in all the discipline. When we are deciding about allocating our resources, we have to consider the diminishing marginal utility and diminishing marginal productivity in allocation of resources. And for the utility maximizing rules, what is the rule? The rule says that the marginal utility gained from the last dollar spent on each product is equal across all goods and services purchased. Means that if you have if you have a limited budget and you wanted to know how you can allocate this budget between the medical services in the left side and all the other goods and services such as housing, traveling, clothing, and foods in the right side, and we show that by Z. So the utility maximizing rule says that spend your allocate your resources the way the marginal utility of medical services with respect to the price of the medical services to be equal to the marginal utility, means that additional utility you get per dollar in spending on the other goods and services. So this is the equilibrium, means that in equilibrium, each additional dollar you wanted to spend in the left side or right side, you get the same amount of additional utility and happiness both sides. That's the equilibrium point. Now, what can change this equilibrium? So we have actually 4 variables in our hypothetical model. One of these should be changed. Basically, say that what if the price of medical services change? So initially we have the optimal mix of physician services and all other goods services. This is an optimal mix of physicians services and all the other goods and services. What if the price of physician services decreases? So if the price of physician services decrease in the denominator, means that with each additional dollar, we can actually get more utility from the left side by spending on physician services than in the right side, at least at the beginning. So we get less satisfaction per dollar from consuming all the other goods and services, and more satisfaction in spending on physician services. So more units we spend more unit of physician services and less unit of all other goods. Up to the point, because of the diminishing marginal utility, again, the ratio step by step decreases, and both sides and become equal to the right side, until again we get the both sides in equilibrium because of diminishing marginal utility. The law of demand is actually based on 2 factors. It shows the inverse relationship between the price and quantity demanded of each product. So, for example, here we are talking about the physician services. We wanted to see the relationship between these 2 variables, price and quantity demanded. Now, if we wanted to drive the law of demand for physician services, we say that for its derivation, we look at the utility analysis or the income and substitution effect that we explained what are the income and substitution effect. So there is a downward sloping demand curve because there is an inverse relationship between price and quantity demanded. So the price in healthcare is the price unit out of pocket expenses that we pay, because we don't pay the full price. So the price for consumer is whatever they actually pay out of pocket. After the impact of price per unit out of pocket expense, after the impact of third party payment has been taken into account, means that after the insurance basically coverage. So we wanted to determine the law of demand, the demand curve. What is the shape of demand curve? We have the individual demand curve for physician services, and we wanted to show how we can draw this demand curve. There is a price in the vertical axis, and there is a quantity demanded in the horizontal axis, and we see that initially the price is a P0 and the quantity Q0. By decreasing the price of physician services to P1, the quantity demanded is increasing to Q1. So that's the same thing. This shows the inverse relationship between price and quantity demanded. And we are assuming ceteris paribus. This is movement along the demand curves, right? We are not shifting or moving the demand curve. We say that movement along this demand curve, any price lower, we end up with the higher quantity demanded along the demand curve. Now, This inverse relationship between price and quantity is due to two facts. One is the substitution effect, means the decrease in price of physician services, for example, consumers substitute away from the relatively higher price medical goods. For example, if hospital outpatient services is a good substitute for physician services in clinic, then by decreasing the price for physician services, you're going to go regularly to your doctor and decrease your demand for hospital outpatient services, right? So this is called the consumer substitution effect. Consumers purchase or patients purchase more physician services and substitute away from hospital outpatient services. Quantity demanded for physician services increases because of the lower prices. The income effect says that because of the decrease in price of physician services, the patients are richer, right? Because instead of paying for $200 per physician services, now with the lower price of $30, that makes them richer. So instead of going to the physician services one time a year, maybe they can go twice a year, or maybe even more, to control their chronic diseases. So this decrease in price of physician services because of the income effect increases the real purchasing power of the consumer or patient in real income. And we are assuming that the medical care is a normal good, because the income effect, there are two effects. One is for the services or goods and services, they are normal good, means that by increasing the income, decreasing the price, you're richer and you're consuming more, spending more on that goods and product because of the normal good. But there are a few cases they call inferior goods, and those are the goods that by decreasing their price, you are richer, so you can actually substitute for the better goods and services. For example, if public transportation considered as an inferior good, if you become richer because of the decrease in the price of the gas, you use your car more and you actually use public transportation less, because public transportation is an inferior good, and by decreasing the price of public transportation, you may actually have more money in hand and decrease that and use your car instead. So because of the income effect, the substitution effect, quantity demand of physician services increases with the rise in purchasing power. So you're richer, so you can actually spend more. So the law of demand says that there is an inverse relationship between price and quantity demanded. That is moving along the demand curve. And the law of demand shows the inverse relationship between quantity demanded of physician services and the price. The income and substitution effect both can be used to derive this inverse relationship between the price and quantity demanded, and basically derive the law of demand. Demand for medical care is equal to it's a derived demand, and it depends on the demand for good health, basically. Now, the demand for medical care equation is the movement along the demand curve, but we also have a shift of the curve. So we wanted to know what factors are movement along the demand curve and what factors are shift the demand curve. The demand, it's a function of price, and which in healthcare is out-of-pocket price, and all the other factors such as income, opportunity cost of travel, basically to the medical services, and prices of other related substitute and complement goods and services, taste and preferences, profile of each individual, and a state of health and quality of care. They're all affecting the demand curve. And only the first one, the price of the medical services, is movement along the demand curve. All the other factors are shifting the demand curve. So the movement along the demand curve is a change in the price of medical services, which generates a change in the quantity of demanded. So all the other factors are shifting the curve to the right or to the left. A change in any other products, such as income or time cost, shifts the demand for medical services. For example, shift in the demand curve, as we said, the three main one are the income effect, prices of other related goods and services, and the time cost or opportunity cost of time. So the income effect means that if there is an increase in income, your income, so you got a raise and there is an increase in your income, so that actually increases your purchasing power, and so therefore that shifts your demand for medical services to the right. So we are assuming that the medical care is a normal good, means that by increasing your income, you're consuming more, as opposed to the inferior good that with increasing the income, you're consuming less. So by increasing income, the demand curve shift to the right, and by decreasing the income, the demand curve shift to the left. So if you wanted to show the shift, we say that in the vertical axis we have the price and we have the quantity demanded in the horizontal axis, and at each specific price level, your demand actually shift to the right, means that with the same price, your demand increase by increasing your income to the right. So assuming all else being equal, the prices of other goods, other related goods, for example, those goods are complements in consumption. They have an inverse relationship with the demand for the product. For example, if two products are complement in consumption, for example, two or more goods, they are used jointly for consumption purposes, then an increase in the price of one good inversely increases the demand for the other goods. For example, you can in the medical care, we can say that if the price of optometrists increase, the demand for eyewear and services of an optometrist are actually they're inversely related. So suppose that the optometrists are increasing their rates, and the price of eyewear is the same, but by increasing the optometrist's visit, so what's going to happen for your demand for eyewear? So you can't afford to go to the optometrist the same, basically regular number of the time per every 2 years, for example. You're going to go every 4 years, maybe every 6 years, because of increasing in the price for optometrists. Your demand for eye care also actually inversely decrease. There is an inverse relationship. So although the price of the eye care is the same, but your demand will be actually decreased because of the increase in the related prices. For example, for pediatric services and obstetric services, that's the same thing. They are used always most of the time together. Another good example is when the price of daycares are very high, the people are hesitating to plan for having kids because so basically the demand for planning to have a family and having kids decrease because of increasing the price for daycare. The price of other goods are also, if some of the goods are they can be consumed as a substitute, is positively related. For example, two or more goods with similar characteristics providing the same utility, if the demand for one good is directly related to the change in the price of the other of the substitute good. For example, if the physician services in clinic as outpatient services and hospital outpatient services are very actually similar and can be substitute, and if the price of the physician services decrease, definitely your demand for hospital outpatient services is going to be decreased as well. So there is a positive relationship. By decreasing the price of physician services, your demand for hospital outpatient services decrease. By increasing the physician services prices, your demand for hospital outpatient services increase as well. So there is a positive relationship between price of physician services and demand for substitute services, or the relationship between the prices of generic and brand name drugs demand. If the price of generic drugs decrease, so therefore the demand for brand name drug decrease as well, or vice versa. If the price for eyeglasses decrease, the demand for contact lenses decrease as well, because everybody is going to increase their demand for eyeglasses. Everybody is going to increase their demand for eyeglasses by decreasing the price for eyeglasses and decrease the demand for contact lenses. Time cost refers to opportunity cost of your time, is a monetary cost of travel. It's most of the people, economists, they actually relate that to your wage rate. So the opportunity cost of time you travel to the medical care, in healthcare basically, the dollar value of the activities the person foregoes while acquiring medical services, now is inversely related to the demand for medical services. Means that if you need 2 hours to go to the physician care, then you are missing 2 hours of your work. So as you're earning more, these opportunity costs are bigger in terms of labor market outcomes, basically. Examples of increasing time costs, for example, the farther an individual has to travel to see a physician, means that you are basically, the opportunity cost of your time is bigger, and it depends on your the opportunity cost of your time in the labor market in terms of dollar value. The longer the delay getting an appointment, the same thing. So as you can see, the opportunity cost of going to the doctor for elderly is very, very low because they don't work in the labor market. So if you wanted to calculate the opportunity cost of time for children and elderly, this is smaller than those are in the labor market, in the labor force. Health insurance and the demand for medical care, by growth of the health insurance coverage, so basically this greatly influenced the allocation of resources, because it's decreasing the healthcare expenditure, having the insurance impact and out-of-pocket payment for healthcare. So in 1960, half of the total expenditures were basically out-of-pocket payment. But in 2010, this actually decreased to 1/8 of total expenditure. So recently, the people can afford more to go to the doctor and actually they afford the medical expenditure more because of having insurance. So the price of medical care are much lower than previously without having insurance. The impact on out-of-pocket payment for hospital care is the same. In 1960, it was hospital care. When you had to go to the hospital, you had to pay 21% out of pocket. Now it's even less than 3% these days. So that actually changed the consumers or patients' attitude for allocation of their resources or their budget in between medical care versus the other services, goods and services they have.